Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Giardia Infections. Introduction. Giardiasis is an illness that causes diarrhea. It can also cause stomach cramps and nausea. The illness is caused by a parasite. You can get the illness if you swallow the parasite. It lives in soil, food, and water. Symptoms of a Giardia infection may be mild or severe. The best way to prevent it is to practice good hygiene. Washing your hands often can prevent the spread of the parasite. This program explains Giardia infections. It talks about symptoms and causes. It also covers diagnosis and treatment. Giardia infections. The illness is caused by a parasite. It is called Giardia, short for Giardia intestinalis. Giardia is found in dirt, food, and water. It may be found in areas that have been contaminated by feces or poop. The parasite can be found around the world. If a person swallows the parasite, they can become infected. The parasite lives in the intestines. It is passed in feces. The Giardia parasite can live outside the body for weeks or months. This makes it easy for it to spread. Animals can also become infected, including beavers, cats, cattle, deer, dogs. Sometimes the illness is called beaver fever. Some people think of it as a camping or backpacking disease, but anyone can get the infection. People are more likely to become infected if they do not practice good hygiene, drink unsafe water or use ice made from unsafe water, have close contact with an infected person, swallow water while swimming or playing. Other people who are at risk for infection are backpackers, hikers, and campers, people who come into contact with feces through sex, people who travel abroad, young children in child care settings. Symptoms. Diarrhea is the main symptom of a Giardia infection. Other symptoms include greasy poop that floats, passing gas, stomach or abdominal cramps, upset stomach or nausea. Symptoms of a Giardia infection may lead to weight loss. They may also cause dehydration. Dehydration is a loss of body fluids. Some people have no symptoms at all. Others may have symptoms that last 2 to 6 weeks. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Infections happen when a person swallows the Giardia parasite. There are many ways that this can happen. People can get the parasite on their hands if they touch a contaminated surface. It can be contaminated by the feces of an infected person or animal. Common surfaces that may be infected are bathroom handles, changing tables, diaper pails, toys. A person can swallow the parasite if they drink unsafe water. They can also swallow it if they use ice made from unsafe water. If you swallow water while playing or swimming, it could lead to an infection. The Giardia parasite may be found in untreated water from lakes, ponds, rivers, springs, streams. The parasite can be found in food. If you eat uncooked food that is contaminated, it could lead to an infection. Close contact with an infected person could also cause infection. The parasite can spread through the feces of an infected human or animal. Giardia infections happen all over the world, but they are more common in certain areas, including Sub-Saharan Africa, South and Southeast Asia, Central America, western parts of South America, Eastern Europe. Diagnosis. Your healthcare provider will ask you about your symptoms. He or she will also ask about your health history. Your healthcare provider will perform a physical exam. This helps rule out other possible causes of your symptoms. If your healthcare provider thinks that you may have a Giardia infection, your stool may be tested. Your healthcare provider may ask you to provide several stool samples. These samples are collected over a few days. Treatment. Treatment depends on how severe your symptoms are. Symptoms may be mild or severe. Most people and children who have no symptoms do not need treatment. The infection will clear up on its own. An infected person may not have any symptoms, but they may still receive treatment. This is to prevent the spread of the parasite. Treatment may be given if a family member is pregnant, other family members are sick. Many people with mild symptoms also do not need treatment. If they are likely to spread the parasite, then they may be treated. If treatment is needed, prescription drugs can be used to get rid of the infection. Many of the medicines used to treat Giardia are not safe to take if you are pregnant. Pregnant women with mild symptoms may not be treated. Your healthcare provider will decide the best treatment if you have severe symptoms. Prevention. You can lower your risk for a Giardia infection. This section covers easy steps you can take. They may help you prevent this type of infection. Hand washing is the best way to defend against germs. Wash your hands for at least 20 seconds. Help young children and other people you are caring for with hand washing. You should also wash your hands before and after you prepare food, before eating food, before and after caring for someone who is sick, before and after treating a cut or wound. Also wash your hands after you blow your nose, cough, or sneeze. Change diapers or clean up a child who has used the toilet. Handle pet food or treats. Touch an animal or animal waste. Touch garbage. Use the toilet. It is also important to prevent the spread of the parasite in child care settings. Do not bring your child to a child care setting if he or she has diarrhea. Do not send them back to child care until it is stopped. You can prevent the spread of Giardia at recreational water areas. Make sure that you shower before you swim. Do not swim if you have diarrhea. Take children on frequent bathroom breaks. Wash your child after a diaper change or after bathroom use. Change diapers in the bathroom, not by the water. The parasite can be found in water. To prevent an infection, do not drink untreated water. Swallow water in swimming pools, lakes, rivers, and other water sources. Use ice made from unsafe water. If you are not sure if drinking water is safe, you can drink bottled water. Disinfect tap water. Heat it to a boil for 1 minute. Do not eat food that may be contaminated. Wash fruits and vegetables with safe water. Peel them before eating. Do not eat raw or uncooked foods if you are in an area with poor food and water treatment. It is also important to clean up after ill pets and people. Disinfect places that may be contaminated. Minimize contact with animal feces. Prevent contact with feces during sex. Wash hands after gardening, even if you wear gloves. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Giardiasis is an illness that causes diarrhea. It can also cause stomach cramps and nausea. The illness is caused by a parasite. You can get the illness if you swallow the Giardia parasite. It lives in soil, food, and water. It may also be on surfaces that have been contaminated with waste. Symptoms of a Giardia infection may be mild or severe. It is diagnosed with stool samples. These samples may be collected over several days. People and children with mild or no symptoms may not need treatment. Medicine is given when treatment is needed. You can lower your risk for a Giardia infection by cleaning up after ill pets and people, not eating food that may be contaminated, not drinking unsafe water, practicing good hygiene, preventing contact with poop during sex. Thank you for using Explain.